Now more than ever, we are making major strides in the fight against cancer, and some of these incredible advancements are happening right here in Central Florida. Joining us now to talk about one of these is Dr. Tirrell Johnson from the Orlando Health Cancer Institute. Thanks so much for being here with us today.
Thank you for having me.
All right, so we're hearing a lot about advancements in cancer treatment these days, but this one that we're talking about is truly incredible. Tell me about TIL. What does TIL stand for and how does it work?
TILs are tumor-infiltrating lymphocytes. It is a mechanism to treat cancer by using the patient's own immune system. We obtain a piece of the tumor. Each person's tumor has specific antigens, meaning surface antibodies that are particular to that person's particular cancer. We make T cells, which are, your body's immune system. Those T cells hone in on the cancer. They go in and attack the patient's cancer for them.
How long does this whole thing take from the time you can diagnose the patient to procuring the T cells and then replicating them and getting them back to the patient?
Okay, so the whole process takes a few weeks. We set them up with one of our surgeons. We have multiple surgeons for different tumor types. The surgeons take a piece of the tumor. We send the tumor off for processing. They develop the T cells. They grow the T cells in the lab. We bring the patient back. We give them a low dose of chemotherapy that primes the body to accept the cells. We give the cells back. We wait for the immune system to recover. And then the patient is done with the process and gets discharged from the hospital.
And the incredible thing is, usually it's just one treatment.
Yes, this is a one-time treatment. We monitor the patient closely after receiving the cells, and then hopefully the tumor melts away.
What kind of cancer can this be used for?
What this was originally developed for was melanoma. This has worked so well in melanoma, we're expanding it to other tumor types, including lung, endometrial carcinomas, head and neck carcinomas.
Are there any downsides to this? I mean, it all sounds great. One treatment, you have cancers that are a year plus and have had no return cancer. Are there any negatives?
So the TILs process is very involved, so the patient has to be very dedicated to the process. You're in the hospital for about 2 weeks in order to receive the total treatment. But the pluses for most patients outweigh the negatives.
It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/cancer.